In this episode, we're going to cover a topic about Redensyl, Procapil and Capixyl and how it can be used and what its role is in the management of hair loss. So stick around.
Welcome to the Hair Loss Show, where two of Australia's leading hair restoration surgeons, Dr. Russell Knudsen and Dr. Vikram Jayaprakash, discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
All right, so one of the questions that we commonly get on the channel is, can you talk about Redensyl, Procapil and Capixyl, and they're compounds that are generally used together. And been asked that question for quite a while now, and I've always hesitated in actually doing this video because I'm going to start on a topic that I really don't have a lot of experience in. But I've done a fair amount of research on the topic, so I'll give you what little information that I have. I haven't had any patients that have used it. I've not seen the outcomes from it, and the availability of these compounds is very dependent on where you live in the world as well. So let's quickly sort of go through it and understand a little bit more about it. So Redensyl is basically, it's a botanical substance. It's dihydroquercetin and epigallocatechin, and basically what these compounds do is that they stimulate fibroblasts in the outer root sheath, and therefore stimulate the hair to grow. And it's usually combined with another compound called Procapil, which is also plant derived from oleanic acid, which comes from olives. And what this is purportedly meant to do is it inhibits the 5-alpha reductase enzyme, both type 1 and type 2. So working in a similar way to finasteride and or dutasteride as well. And the third compound that usually comes with it is something called Capixyl, which is a biomimetic peptide. And what this does is it increases hair width and density. So these are what you'd say is naturally occurring compounds, and usually you take them in combination with each other, so the three compounds together. So to come back to how effective it is, again, I've not seen in large cohorts the use of this, and therefore I can't really speak to authentically how effective it actually is. I've seen one study where it compared the use of this combination, they call it RPC, with 5% minoxidil. And they studied 124 patients, I believe, and there was a choice, they assigned either the RCP or the 5% minoxidil. And then they gave the patient a questionnaire they did that for 12 weeks. And they gave the patients questionnaires to how they felt about their hair, and they would mark them out of 10. And also they had assessors come in and also qualitatively try and assess how the hair loss was progressing or certainly improving over the period of 12 weeks. And what they found was that there was a significant improvement in the group that had the RPC in comparison to the 5% minoxidil. I'm being very vague because the results were also generally equally vague as well. But certainly from a patient's perspective, all their self-reporting showed that the group that were on the RPC were generally felt that they had a greater deal of improvement in their hair density and thickness compared to the group that was just on the 5% minoxidil. So this is only one study. It's not something that has been studied extensively, and and whether it will be, or there are future studies that are currently being done, I'm really not sure. But it's certainly something that people may want to consider and trial and see how effective it is. I think at the end of the day, like with most things, the proof is in the pudding, and if you find that it's effective, then certainly try that. But I hope that sort of unpacks a little bit about what this particular compound is. Again, it's not available everywhere. You have to check in the country that you live in how you can get that if you want to get that and make that up. But that's basically a summary on Redensyl, Procapil and Capixyl. I hope you found that useful. Thanks again for watching. Please keep the questions coming and we'll see you again on the next episode. Take care.